quick assessment, make sure you're all good, all right? Can I check the wristband? Say your name and date of birth for me. All right. Okay, so starting off, our patient's GTPL was 11001. This was her first pregnancy. She was alert oriented ×3 to person, place, and time, as evidenced by she stated her name, her date of birth, the actual date of the day, and where she was at the hospital. She had long, dark black hair that was brushed and neat on the top of her head. Her eyes were midline, and there was no drainage present, and her sclera was white with no evidence of jaundice. Her oral mucosa was pink and moist without any lesions, and her teeth were also present with no abnormalities. Her lips were also pink and moist. Skin turgor was taken on the right clavicle. The return time was spontaneous, indicating adequate hydration. The skin was appropriate for an African American female. It was warm, dry, and intact. Everything, well, I say intact, she did have an IV site located on her left arm. The IV site itself was clean, dry, and intact, and there was no evidence of like bleeding or bruising or drainage present. And she also did have an episiotomy, but we'll get to that. She did report having chills, but no excessive sweating. She just got cold. Capillary refill on the fingers was taken on the bilateral index fingers. Its return time was spontaneous both times, indicating adequate perfusion to the hands. Patient had no difficulties ambulating or strength. Her gait was slow, but it was steady, and she had no weakness present in the upper or lower extremities. Patient was also on a regular diet. She ate 75% of her breakfast and 50% of her lunch, and she had no difficulties eating and did it independent. The patient's breasts were soft, non-tender, non-lactating, and appropriate for an African American ethnicity. She was free of any signs and symptoms of mastitis, of like tenderness or like leaking fluid or pain. The nipples were exverted outwards. The areolas themselves were actually pink and free of crackles or like fissures, or there was no pain. The patient's abdomen, I'm gonna just leave this pulled out a second. The patient's abdomen itself was soft, warm, and dry. It was convex and non-tender. She didn't have any pain in her abdomen. Her fundus was midline and firm, and it was +2 to the umbilicus. And these are normal findings according to Olds 857. Listen to bowel sounds. The patient's bowel sounds were present ×4 in all quadrants. They were normal active frequency. Patient reported that she hasn't had a bowel movement since before delivery. She hasn't had one since the birth of her child. She had no complaints or flatulence or constipation pains. So she had no constipation. Patient did report mild discomfort and pain in the perineum area. Because she had a vaginal birth and an episiotomy, which I did assess, and it was also intact, and the edges were well approximated with no bleeding or drainage present. So she had a perineal pain. At first, I asked her for pain, and she said it was a 6 out of 10. but she did get an oral analgesic, and then she later reported that her pain was a 3 out of 10. She had moderate loci rubra on the first pad that was assessed at 8 o'clock, and then every pad after that had a light amount of loci rubra. Every pad was free of purulent drainage or clots, or there was no foul odor or signs of infection or abnormal bleeding. These are normal findings according to Olds, page 858. And then flipping the patient over, I assessed her anus area, and she had no hemorrhoids present, so she had no hemorrhoidal pain. During clinical time, the patient voided twice. Both times the urine had no foul odor. It was a yellowish red color mixed with like a urine color and then a little bit of blood. There were no clots in the urine both times. The no foul odor, and it was a moderate amount both times. The patient reported no pain or difficulty while voiding. Moving to the legs. The patient had a negative Homan sign in bilateral legs both times, as evidenced by she reported no pain whenever her legs were dorsiflexed up. And also capillary refill was taken on bilateral big toes, and the return time was also spontaneous on the feet, indicating adequate perfusion to the legs. She also reported having feeling in her legs. She could feel, and she had no numbness or tingling, which would be a side effect of prolonged anesthesia of effect. Temperature was taken orally twice during clinical time, one at 8 o'clock and 12. The 8 o'clock was 98.8, and the 12 o'clock was 97.9. Both of these are within the normal limits of 97.1 to 100.4. The pulse was taken radially and apically. So the radial pulse at 8 o'clock was 88, and at 12 o'clock it was 82. It was bounding with a regular rhythm both times, and both of these readings are within the normal limits of 50 to 90. The apical pulse was also done twice at 8 o'clock and 12. Left midclavicular line, the 4th and 5th intercostal space, and it was also done. And at 8 o'clock it was 90, at 12 o'clock it was 84. It was also bounding regular and without murmurs or abnormal palpitations or abnormalities. Respirations were assessed also at 8 and 12, and they were both 20 both times. This is within normal limits of the 16 to 24 normal range. The actual rising of the chest was even and smooth, indicating that one lung was, like both lungs were opening at the same time. It was smooth and with a regular rhythm. The lung sounds were assessed bilaterally, anterior and posteriorly. Like I said, both the anterior and posterior bilateral lung sounds were all clear. There's no evidence of like crackles or wheezing, which would have indicated like fluid buildup. The patient reported having no shortness of breath, difficulty breathing, a cough or chest pains. The patient's oxygen saturation was taken at 8 o'clock and at 12 o'clock. And at 8 o'clock it was 100%, and at 12 o'clock it was 98%. Both of these are within the normal limits of greater than or equal to 95%. The blood pressure was taken on the right arm both times. And at 8 o'clock it was 106/62, and at 12 o'clock it was 109/57. Both of these are also within the normal limits of 90 to 139 and 50 to 89 normal range. The patient's overall appearance was clean and green. She did appear showered. There was no halitosis or foul odor on the patient. Her hair was brushed and clean, like I said earlier. The patient showed no signs and symptoms of postpartum depression, as evidenced by the mother and the father were both active in the patient's care of the newborn. They both held the newborn multiple times, and the mother actually called family and friends on her phone and FaceTime, and to show the newborn. And they often smiled and laughed, talking to each other and looking at the newborn. The patient stated that her labor was actually the most difficult part of all of it, because it was so long, and the delivery itself was the easiest part because of the epidural. She didn't have any pain or really didn't feel anything. And the only patient's pre-existing medical condition is she did have asthma, but this produced no difficulties in labor or postpartum, as evidenced by the patient had adequate oxygen saturation, clear lung sound, and no complaints of shortness of breath. That's my assessment. Thank you.